Sadly, in the next 11 minutes, when we gather here, one people that are alive will be dead from suicide. Good morning to the Honorable Lecturer Miss Ira and to the audience. Ladies and gentlemen, my name is Silvia Wulandari from State University of Malang. Today, I'm not here to tell you about myself. Instead, I will tell you about one kind of mental issue that is very important to know. Mental health matters and must be taken seriously. That tagline should be spread and understood by many people. Around 43.8 million adults experience mental illness every year. That's a big number of people, right? We know how it feels to have our lives or the lives of people we love get off track because of mental illness. We understand that mental illness is serious and can get absolutely devastating. We want to let people living with mental illness to know that they are not alone and there's always a hope for a better day. Before we jump to the topic, by show hand, let me ask, how many of you know someone with bipolar disorder? Alright, so apparently there's not many of you know it yet. Will it shock you to know that there are about 45 million people worldwide suffering from bipolar disorder, with people on the age of 18 to 29 years being on the highest rate? To begin with, some of you may not familiar with bipolar disorder, so let me give you a brief explanation. Bipolar disorder, which used to be called manic depression, is a serious mental illness that causes unusual shift in mood, energy, activity levels, concentration, and the ability to carry out day-to-day tasks. Such emotion can move to extreme lows, called depression, to extreme highs, called mania. But this shift doesn't happen moment to moment. In fact, they usually happen over several days or weeks. Bipolar disorder is typically diagnosed during late adolescence or early adulthood. Occasionally, bipolar symptoms can appear in children. Although the symptoms may vary over time, bipolar disorder usually requires lifelong treatment. There are few types of bipolar disorder, but there are some common features that you need to know. Let me tell you some of it. First, there is bipolar 1. In this type, individuals with this can feel hopeless and discouraged, lack of energy, and even physical symptoms such as eating and sleeping rather too much or too little. This type of bipolar disorder is characterized by manic episodes with or without depression symptoms, and it usually lasts for about a week or even longer. And then second, there is bipolar 2. This type is characterized by having both manic and depressive episodes, and it is usually less severe and only lasts for about 4 days rather than a week. And for the third, there is cyclothymic disorder. In this type, individuals may experience both manic and depressive episodes for 2 years or even longer. The cyclothymic disorder causes unstable moods, meaning they may have periods of normalcy mixed with mania and depression. Sometimes a person with severe episode of mania or depression may experience psychotic symptoms such as hallucination or even delusion. Proper diagnosis and treatment can help people with bipolar disorder to lead to healthy lives. Talking with a doctor or other licensed health care provider is the first step. But the problem is, lots of people with this disease actually had a hard time to come out and ask for help. When adolescents experience symptoms of mental illness, it takes an average of 8 to 10 years for them to access treatment. And it is our job to reach out to them and persuade them to get a proper treatment. We need to make it easier for them to recognize and talk about their experience so that they can get the help they need. Even though there is no cure for bipolar disorder, but this disease is actually treatable. So, identifying and treating individuals is really important since there's a real danger that the person could harm themselves or even commit suicide. And lastly, if you or someone you know has bipolar disorder, don't be afraid to ask for help. And remember to always be patient. Treatment takes time, and it is important to stick with it to feel better and enjoy healthy life. You don't need to deal with bipolar disorder on your own. That's all from me. Thank you for your attention.